Hey everybody, this is Nicole Harris-Roberts with VYNYL, and I am joined here today with a wonderful panel about why mega healthcare is so challenging. And I am joined today by Veronica Seo. She is the head of product at TRUEPILL. We also have Tara King-Hughes, Senior Director of Product Management at STRAVA, and Alicia Pina, who is a Principal of Strategic Planning and Performance at Blue Shield of California. Welcome to you all. Thank you so much for being here. So Veronica, tell us your story. How did you get started in product management?
Thank you for having me, Nicole. I'm really happy to be here on this panel. I've been in product management for a good 15 years, previously in financial services, then did a few years in healthcare at Kaiser Permanente, stepped away from the financial services and healthcare, moved to insurance, and then recently joined TRUEPILL back into the healthcare space, leading the product team for consumer health at TRUEPILL, a Series C startup. And we provide digital platform capabilities for the healthcare industry to provide direct-to-consumer experiences for all the major players within the healthcare space.
Excellent. Tara, why don't you tell us how you got into the healthcare space? I understand your background is quite varied as well.
Yes, it is. I started my career off being an engineer and was pushed into the field of product because I had such a passion for quality user experiences. I've spent the bulk of my career at a media company prior to coming to STRAVA. And it was during the pandemic where I wanted to align every part of my life with my passion. And my passion is health and fitness. And so the stars perfectly aligned and led me to STRAVA. And so I just recently started there in February. And so at STRAVA, we are redefining the athlete and stating that it's not a football player, basketball player, it's anyone who sweats. And we're motivating people to be the best at their own pace. And we're also creating new experiences to connect and motivate individuals to meet their fitness goals.
That's awesome. I can connect with that very well. Anybody can, right? It's so inclusive. I love that. Yeah. And then Alicia, tell us how your background is totally different, but yet here you are, a product person in healthcare. How did you get there?
Well, it's been a crazy ride, right? So thank you first for having me. I first started my career in nursing, and I thought that's where I wanted to go as a woman in a culture that, most of us were told you have to go into nursing. That's the place that you're going to get paid. And so that's where I went. I spent 10 years at Sutter Medical Center, and whether it be neuro or ICU or pediatrics, I did find that I was more of a problem solver, engineering type mindset. And so I took a leap, left healthcare, and found myself in high tech at Intel. At Intel, I was a project manager for graphics engineering. I found myself in the love of the problem solving, but there was still a disconnect for me. There was still a piece that was missing, and it was that healthcare. So aligning again, like Tara, my purpose and passion, took a big leap and went over into a not-for-profit that was founded by physicians, Blue Shield of California. Been there for the last 5 years in product strategy, working towards, making healthcare access for all, but also affordable. Something I'm very passionate about, especially when you look at areas where systemic issues are, where we don't have good access to care. How do we meet the member where they are? So I'm really happy to be where I'm at, and I'm looking forward to this panel.
So interesting too to hear that you have the frontline experience and bringing that into healthcare. I think that some people tend to find that being a product manager in healthcare, it's sort of a requirement that you need to care about healthcare. And I think it's natural for people to sort of gravitate toward that. People like you, people like Tara. But not everybody feels that way, right? I think Veronica in our prep call, we were talking a little bit about passion PMs and people who feel like, they gravitate toward healthcare for whatever reason. Can you talk a little bit about the folks that you've been working with or are seeing out there, people like us who are sort of, what are you seeing in terms of the mix? Are most people sort of passion PMs and really want to make a difference? Or are you also seeing people who are just like product is product is product, and healthcare is sort of just it just happens to be the industry that I work in?
Yeah, I think that's a great question. And it's actually a good mix of both. Definitely a lot of folks who maybe were planning to go to med school, or they come from a generation of pharmacists or doctors. And so they've always been attracted to the space, but for whatever reason didn't actually go directly into the medical field, or were transitioning from the medical field to the business side of things. But I think what is a commonality for everyone who works in healthcare, in products or otherwise, is everyone has experienced the challenges of healthcare in America. And so in product, you get to really try to solve those challenges in a lot of different ways, because the healthcare ecosystem is so complex in the US. It's been, brought up many times about the need to disrupt healthcare, to consumerize it, to make it more accessible, to make things more transparent. And it's been a really tough nut to crack. So I think whether you're coming here because you have a passion for healthcare in particular, or you love product management, like in my case, at the end of the day, you really want to solve those problems for those millions of patients out there that are experiencing those issues and those challenges.
Let's dig into that a little bit, the challenges. Why? So the premise that I'm about to pose is that doing product management in healthcare is different than in other industries, right? Why is it different? Tara, I want to start with you because you have an engineering background. You have not always worked in a health and wellness sort of space, but tell me what you're finding in terms of, well, I guess first question is it different in your opinion? And if so, why?
Yes, I think it's different because you have to be thoughtful when you're a product manager in this space, because you're actually have the possibility to impact someone's both mental and physical well-being. So you have to put that user, or in my case, the athlete or the patient first when you're building and thinking about features. I think other industries don't have to consider that as they're building products. But I think when you're in health and in healthcare, you do, because you have to put that patient, user, athlete first. And you have to think about it in every phase, every idea, every feature. When you're building a product, you have to build it around that person. And the goal is not to cause harm, it is to add value.
I think to add to that, consumerism is really different, right?
Yeah,
and in the big tech, high tech industry like Apple, you have people that will wait in lines to get the same product. But in healthcare, it's not a one size fits all. In STRAVA, you have multiple age bands, and your older group is going to feel like that athlete. And I will tell you that I recently used STRAVA on my Peloton, and I am trying to increase my score. So I love that. But it has to meet that person where they're at, where they need it, when they need it, and sometimes even before they need it, that they even know they need it. And so it's very complex because it's human, and you have to be courageous, and you have to be very vulnerable and think outside the box and all the different points that you may touch by making that one change.
Yeah, and I will say also with healthcare, there are so many legacy technologies and platforms that we're all working with, and that were not designed for direct-to-consumer experiences. And so as consumer expectations have changed, as they compare their Amazon shopping experience, or in Alicia's example, the Apple experience, there's a certain expectation of anything that a consumer is interacting with, whether it's healthcare, whether it's e-commerce. And it's been really challenging for healthcare to really hit that mark in terms of providing that experience that people expect, because of the legacy technology that was never designed to create really great end-to-end, great UX user experiences, as well as what Tara mentioned, all of the stakeholders and players in this space. It's a multi-sided marketplace, right? If I create a great digital experience in the healthcare space, I have to think about the clinical impacts, the provider impact. Is there a PBM impact? Is there an insurance impact? And so all of these things create a lot of complexity and nuance when you're trying to build solutions. And sometimes they actually, can handcuff you, even though it's the right patient experience. For whatever reason, due to a HIPAA reason or a technology limitation, you're not able to deliver on that promise that you're trying to deliver.
Would you be comfortable sharing an example of that? An example of something where you and your team identified an opportunity and wanted to deploy that capability, but could not do it?
I will share a previous employer where I had that experience, where we had a fantastic vision of what a consumer digital experience should be for a patient. And it was approved by the board, it was funded, we had the resources lined up, and we ultimately couldn't do it because of the legacy EMR, EHR that we were using, which was not willing to build those services for us to enable those experiences, because that particular EMR was also producing an out-of-box software solution that their other clients were using. And so in their mind, there was no reason for them to prioritize that work, which completely makes sense from their standpoint. But because we were fully dependent on that particular vendor for giving us those APIs again, so that we could have control of the user experience. We were very, very limited, and we were not able to, we had to actually cut down scope quite a bit in order to deliver even a piece of that value. And so that really kind of degraded the experience in a big way.
I think, Veronica, it goes back to what you were saying, right? It's the infrastructure. And in comparison to high tech, the infrastructure is built upon velocity, going faster, being able to accelerate your graphics on your processor. In healthcare, it's about how do I make sure the member gets it? How do I make sure the provider understands it? And so the technology hasn't always been at the forefront. I do feel like, though, we have this like soda bottle of like shaking up, right? And you feel that pressure, because it's a beautiful thing when you have these big tech companies coming in and adding pressure to maybe some of the archaic challenges and infrastructures. And so we're almost there. I feel like we're getting it. The pressure is there. We have some really good, healthy pressure coming into the market. It's going to be an interesting, next 5 to 10 years to see what happens. But the infrastructure, I'm with you. It wasn't built to be fast. It wasn't built to be technical, like robust. But I think there are a lot of people that know that now.
For sure.
Yeah, Nicole, actually, I will give you apologies, Tara. I wanted to just expand on the specific example that you asked for. We, at one point in my career, we were trying to build a dashboard experience where you could manage the health for yourself and your entire family in one view. Behind the scenes, what that means as a product manager or as a solutions engineer means calling a lot of different databases to return information to display on a page. And as Alicia mentioned, that infrastructure was not designed to do those things. So imagine hundreds of thousands or millions of users at a time trying to ping multiple databases and trying to render a single page could take 30 seconds to load. And what consumer, regardless of what industry, wants to wait 20 seconds for any page to load? And so those are the kind of things that we're having trade-off discussions about every day. But every time you trade off, performance, you're also trading off experience.
Yeah, and Veronica and Alicia, I would just add, the system is so out of date. I think, spending so many years being tied to physical brick and mortar environments, being so heavily dependent on paper has definitely limited the innovation in this space. But I still agree with you, Alicia, disruption boom is definitely on the way. I think the pandemic has accelerated that tremendously. I think that there are new companies that are coming into this space and innovating in new ways. Both Google and Amazon have made significant acquisitions in this space. So it's now only a matter of time of when the disruption is going to happen. And so I hope in the industry they can start being more forward thinking in this space, because some of these new and upcoming companies that are startups are truly going to challenge the way they do business, challenge the paper, and challenge the brick and mortar.
I agree with you. That data piece, it's so interesting in a data world. You come in an engineering, like data is key. Like it's going to tell you how you're going to solve, what is the problem, where are the bugs, how are we going to validate. The data that we have at our hand, and Veronica, I believe you've already touched on this, is like that, having that data at the front end, right? If you can only imagine, I pick up my phone, I know what my doctor's prescribed to me. I know what not just that prescription, but what are the side effects? What is the symptoms of my diagnoses? And I just went to the store and now I've added this multivitamin. It's holistic care can't just be surface any longer. Holistic care has to lift up the hood and think, if we can't provide a simple hearing aid for a patient, we have to look at the outcomes of that. Isolation, depression, those things come with other conditions that cost us healthcare money, but also cost that patient life, right? And so going back, it's when we design this product, you have to design with the person in mind. And it's not a one size fits all. It has to be all around. And it can't just be for those that can afford it. It has to be for all.
Tara, I want to ask you a specific question following up on what Alicia, you just said. Having solutions that are affordable for everyone. How do we think about that in a consumer product context? Let's STRAVA, for example. I'm somebody mentioned, I think Alicia, it was you who mentioned your Peloton. I'm a Peloton user as well. They've gotten a lot of flack, right, about having a solution that not everybody can afford. So how do you think about this in terms of, Tara, bringing that ideal to everyone as an athlete and then delivering products that people can afford and are accessible for them?
I think one thing that Strava has done very well is to provide both a free experience as well as a subscriber experience. So providing to both so that if you could not afford the subscription, you can still have a very meaningful and valuable experience, still focused on your healthcare, still focused on you having the very best way, a system to help guide you through your fitness plan. Now, if you can afford the subscription, which is something that we try to keep at a very marketable rate, for both here in the States and as well as global, then of course you get additional features. But I think as a lot of companies are just focusing on building subscription, we're focused on athlete first. So ensuring both the free and the paid experience adds value, allows you to complete goals that you want to meet for both fitness across 32 sports. So not necessarily limiting you because you don't have the subscription, but maybe you don't necessarily get all the bells and whistles, but you still have a very meaningful freemium experience with the hopes for you to subscribe. But even if you're not a subscriber, we want you to stay active, and we put key touch points in the product for everyone to remind you to be active. Have you seen this new route today? Check out these maps, find new ways to connect and participate in challenges. And we do that by both valuing both the overall experience for all, as well as the subscription experience.
And I will add that at TRUEPILL, I think our partnerships with our direct-to-consumer brands has really made healthcare more accessible. Because when you think about access, it's not just about the cost, but also about understanding how to navigate the really complex healthcare ecosystem. And that can be very, very difficult. Even as someone who's worked in healthcare now for over 3+ years, I can't say that I could give any sort of seminar about how the American healthcare system works. But I do know there's a lot of barriers there in understanding what your insurance covers, whether certain providers within network, whether a certain type of care is HSA, FSA eligible. And having these direct-to-consumer experiences actually allows users to make a choice to pay out of pocket, in cash if they want to. And providing kind of that transparency in price so that they can make that determination as to how to best fund their care. And so we provide, pharmacy fulfillment and delivery services by mail order. We have telehealth services that, as you guys mentioned, are now accelerated in terms of demand because of COVID and people feeling more comfortable doing video visits versus in person. And so those sort of cost efficiencies are passed along to the patient along the way.
I love that. The value-based care is so important, especially when you can pair that with something like a chronic condition and you want to remove the barriers and remove the cost of prescriptions. Because when you have someone that's like maybe on a Medi-Cal plan or a Medicare plan, where they may not be able to afford the cost of their prescriptions, but they're in a chronic condition, those are things that I love working on because it has a direct impact, and you have to remove that cost barrier again, because it's the medication maintenance, right? Is how do you get the medication to them quickly, and timely, and even if you can mail it to them, that's even better, right? And so I love the way that product healthcare is going, where now you can get your mail, get the prescription mailed to you. You have notifications sent to you when you're getting low on your prescription. Those things that we didn't have like 5 years ago, or even the email connection with your PCP. So the pandemic also has really helped us. And I hope that we'll be able to continue to accelerate that, since we've seen so much great things come from telemedicine and, the providers having that bandwidth, being able to see multiple patients instead of just always the traditional.
This is also bringing up the point that the consumers themselves are key advocates in their own health and wellness journeys. We always have been, right? But acknowledging that as product people, we have to consider the train has left the station long ago. 15 years ago, well, we were having conversations about how hard it was to adapt to what consumers were asking for, and sort of being, I think there was frustration and some trepidation on behalf of product teams to think about how are we going to, not just do we have to, I think that's an old conversation. How are we going to embrace these new motivations that people have to, I mean, why do I have my phone on my person 24/7? I mean, that was not a behavior that I had personally 15 years ago. At a certain point, it was 2000, it was probably 8 years ago, where I left my phone in the car and I walked away and I thought, I panicked actually. I thought, oh my gosh, I don't have my phone. Why is that? Why do I feel compelled to wear this watch around all the time? Right? It's like, I guess there's not really a question in here. I'm just thinking about what is the interplay between our desire to be an advocate and also the technology sort of bolting onto our experiences in such a way that now I depend on my watch and I'm dependent on my phone to keep track of how much I'm walking and, alerting me about everything, including when my prescription refill is ready.
I think the watch is so important. My daughter, who has epilepsy, it's important for me to get that notification when she has a seizure. And so we have the Internet of Things. We have all these things connected that improve the lives of people. I'll tell you, as a mother of an adult child who wants to live very independently out of my house, I need to know, I need that safety net. Right. I need that watch to call me and tell me that she's had a seizure, she is okay, and everything is good. And having that is, for me is good, but we also have this age band, this age population that's rolling in, and we need more connected devices. We need more things like STRAVA to make them feel like the athlete that they are so they can continue their healthy lifestyle. I'm really interested in what the Internet of Things has to bring from that connectivity.
I hope, and that's a very good point, Alicia. And I hope from that connectivity, it brings education. You talk about that band of ageism. And I think in that, we have to understand that there is a population of people who not necessarily be technical savvy, but they have to be to get the very best care, to interact with apps that can streamline some of the complexities in the health space. So education, I think, is something that should be for all. I think certain devices should be for all. I know that there's several like internet companies who offer free internet service or very low cost internet service to reach certain populations, and which is very valuable. But the same thing has to also happen in the mobile space, because to your point, Nicole, it has become the device. It has become just as essential as your wallet to have a mobile device. And I think it's something that we have to get into every home and to every hand through meaningful education.
Yeah, there's definitely something really interesting here as I listen to you all speak, in that, although, we're all coming from different backgrounds and working at different types of companies, but we're all trying to do the same thing aside from solving problems in healthcare, which is providing access to care in a very convenient manner, because ultimately that is preventative care. And I think we know from multiple studies that healthcare expenditure is the highest in the last 2-3 years of life. And if you were to invest those dollars into preventative care and wellness, which is exactly what STRAVA is doing, it sounds like you guys are trying to do the same thing at Blue Shield. We're certainly trying to do that at TRUEPILL with access to care. You can save many dollars and many lives and many years of life. So I think while a lot of us, I think offline tend to disparage technology as being so distracting, in this case, it is really an asset to healthcare to bring healthcare to the masses in a really easy and convenient way.
That age group, though, they're using Facebook, right? My grandmother is on Facebook more than I am. Okay, so there's something, they're there, they're ready. And they're also, speaking for my grandmother, she's looking too for how do I keep fit? That used to be curves out there. I can't find a curves. And so they're looking for that. And I'm going to download that app for her. But they're looking for that extra, right? And so you're right, Tara, it's having that, maybe it's the TV. The TV is already in everyone's homes. It's, already there. We have Fire sticks. It could be that, but it is a device. It is the remote monitoring. It is, connecting with more people, but education is key, because we won't get the device before we have education. They won't believe in it until they learn about it.
I think also without some of the devices and the technologies that we're talking about here, you're just creating more and more friction for people to get care. So before, digital access, before telehealth, if I wanted to see a physician for something that I noticed on my skin, for example, I had to call center, probably have a hold time, try to schedule an appointment, wait for the appointment, have the appointment, get a medication, go to my, local CVS or Walgreens, pick it up, and then maybe have a lab requisition, make an appointment to go do a lab. And so all of these things now, are digitized in some way or can be digitized in some way. And that's actually one thing that my team is really excited to work on now is the at-home lab testing, because you can imagine we kind of solved the mail order pharmacy so that comes conveniently to you. We're trying to solve your physician gave you a requisition to go get a lab test, but you're inconvenienced, you forget about it. But now we're giving people the option, well, actually you can order that and take that test at home and then mail it, and you fulfilled that requisition. So that's super exciting for us. And I think further digitizing or even providing that convenient end-to-end patient experience. And ultimately, again, for care.
Tara, what is your team working on that you're most excited about at STRAVA?
Well, this is great timing to ask that question, because this week we launched on June 2nd, we launched the biggest app release of the year. One was group challenges, where we allow people the flexibility to create their own challenge with your own circle of friends, up to 24 anywhere in the world. And you can build your own challenge so that you can encourage and motivate others in your circle, in your intimate circle, to get out and be fit in any way they choose, whether it's walking, hiking, yoga, the e-bike, the Peloton. It's up to you, and you get to shape this challenge. The other item that was part of the release is maps. So we had maps kind of all over the place. Now it's very centered, and building better segments so that you can track your personal record, and then you can monitor how you're improving over time and with personalized categories. So very, very excited about that launch this week. It's been well received by our STRAVA community, and just going to enjoy these next few weeks to see additional feedback that we receive about our product launch.
That's awesome. And given that you just joined in February, I mean, being able to really release something that people can as tangible and within 4 months, that's pretty good. Maybe that's my healthcare bias. I'm like, 4 months, that's blazingly fast.
Yeah. Congratulations.
Yeah, that's awesome.
Alicia, what about you?
Right now, we're working on, reimagining healthcare. One of the things, if you can go to reimagine healthcare at blueshield.com, you'll see my sidewalk. What I really like about my sidewalk is going back to that education piece. It's showing people what are the barriers in their community, what are the conditions in their community. One thing that I'm really excited about that's coming up, an International Day of the Girl in October, is, reinventing, healthcare is a tech company. We can't no longer be not a tech company. And so part of my role, I work on a diversity and equity and inclusion, serve in that role, is helping our communities as well. And so love being in this seat, because we're going to be doing some STEM related encouragement using what we do here at Blue Shield to reimagine healthcare, whether it be remote monitoring, whether it is the pricing transparency, or the sidewalk I was talking about. So I'm really excited about creating that field trip for them, and showing and showcasing that, the payer too is a tech company, and we need more girls in those STEM related careers. Because we need engineers in healthcare, right, Tara?
Exactly.
That's 100% right. And encouraging. I wonder how I'm hearing a lot of optimism on this call, and I'm happy to hear that. There is a lot of pessimism too when you're down in the trenches and going through and being, just grinding. I wonder if anybody would be willing to share a story of. Alicia, I'm going to pick on you a little bit, because you mentioned something which we didn't bring up as a theme yet, but you alluded to it, was this stakeholder management. Stakeholder management on steroids, I believe, is the phrase that you used.
My role.
At a time when you experienced stakeholder wrangling, and it was complicated. If so, why?
Well, the infrastructure is complicated, right? And so data is complicated. Getting things done is complicated, because everyone has their piece of the puzzle, and everyone has their own set of issues that they're working through. So really my role was created and is about, like, how do we bring all these stakeholders across that are impacting these key growth opportunities or these key areas that we need to, I, by nature, am a very passionate person. I like to get things done. And if it's people related, you might want to put me on the job because I'm a problem solver. However, you know, sending me the member complaint will make me make sure that we get that done, right? And whether it's one member or two, we take it very seriously. And so this role really pulls everyone together to make sure, one, we solve that issue right away, but also what's our long-term plan so that never happens again. And I think that's really about where, a lot of these infrastructure problems are being solved, is putting the accountability and putting the right stakeholders and bringing the right people in. And they're solving those big mega healthcare issues around infrastructure because of that.
I'm reminded of a story I heard. I believe I was a Kaiser Permanente when I heard this story, but an anecdote from a tech company, actually. And they said, and Tara, maybe you'll appreciate this as a former QA person too, until you put the engineer into a situation where they're using the exact same computer with the exact same network connection, right? And experiencing the site in the way that they see it through their eyes. It's very eye-opening from a product and engineering perspective, no? To be able to see things from a member's perspective and hear, like, I can't believe they're having issues with, sign-on, or for example, why is that? And then you watch people actually do it and you think, oh my goodness, why? That's so hard, right? And thinking about, the difference between the ideal experience and what the product manager thinks it's going to be like, a happy path, and then thinking about why are we getting member complaints about sign-on? Let's dig deeper. Let's see what is happening in their experience and why is that happening. That is that's very focusing for people, I think, to put them back into seeing it through the person's eyes who are experiencing the real problem. I guess I will say I want all of our engineers to be able to sit at, one other thing we did at Kaiser Permanente is sit in on into the call center and listen in on the calls that were coming in. And that was fascinating. I don't know, Veronica, you had a chance to do that, but we did that as a shadowing exercise. And oh my goodness, just hearing the things that people come up with, not only, first of all, hats off to people who are in call centers, because especially at a healthcare company, they could get any question. Talk about chat roulette. I mean, they could get any question. It could be, I'm having problems logging in. It could be, I'm having heart palpitations right now. I mean, it could be an emergency, non-emergency. You just do not know. So anyway.
Yeah, absolutely. Actually, that's advice that I give any up and coming product manager, regardless of industry, is to really sit with the frontline people, whether that's a salesperson or a call center person, or in retail, someone who's, helping someone on the floor, or a cashier. You really have an appreciation for the day-to-day, both the user challenges as well as the actual employee challenges. Because I think as product managers, especially those who work on the consumer side, we do over-index on the user experience, and sometimes unintentionally deprioritize maybe our fellow colleagues' experience in the call center, for example. And usually, going back to the stakeholder question, they are definitely a stakeholder, along with your clinicians, along with your end users, along with all the, the marketing, the sales, the operations folks. So it's really important to not forget about that, because those frontline people are the ones who actually have the closest interaction with your customers. And that's really the impression that the customer is going to have of the brand and company as a whole with that interaction. So they got to be happy too, in addition to the users.
Veronica, that is great, because what you also get is you get the real language, right? And we have acronyms, we have our business language, but the call center, they are the front line. They have so much knowledge on how we can improve the customer experience, because they have the raw. And I hats off to them, because you're right, they get all types of calls.
And are we at the point now where the technology tools that we're offering, the digital experience we're offering, is better or worse than a phone call? Should we be solving for the problem of limiting phone calls to the call centers? Or is it the case that there's value in both?
I would say there's value in both, because it's not a one size fits all. Not everybody's comfortable with chat. Chat is great for getting things quick and done, but people still want that white glove service. They still want to call in, especially healthcare is emotional. When I'm stressed, I don't want to deal with chat all the time. Maybe I want to hear a voice on the other side. And so, it has to be a range of opportunity. We don't want to go so far down the road that, we push people to robots. There still has to be a human connection. But for the convenience, we also need that as well. We have to stay up with what you said before, the behavior expectation that the consumer already has by their day-to-day interactions.
So for those of us or those of people in the audience who are looking to, maybe are new to the healthcare space, what advice would you have for them getting started in this industry? And Veronica, I'll start with you.
There are such a wide range of opportunities in products in the healthcare space. And I think some do require specialized subject matter expertise in healthcare in different areas in healthcare, but there's plenty of opportunities out there where teams are just looking for very strong product managers who perhaps have worked in highly regulated industries. So you can imagine, financial services would be a really good comp to that, and a lot of transferable skills. And at the end of the day, it goes back to what we mentioned earlier. You have to be very focused on problem solving, even as you feel that the problem may be insurmountable, because these are problems that have gone on for many, many years. But we now have the technology, we now have the thought leadership, we now have enough kind of tech companies focused on this space to, I believe, to solve these problems.
I will add to that, like health tech and product management. If you want to get into that, I would say, follow your passion, right? First of all, you have to really love it. It's not easy. It's hard. There's a lot of barriers. There's a lot of obstacles. There's a lot of laws. There's a lot of regulation, but it's so worth it. You have to have that passion. And there's different areas, right? Like, Veronica mentioned the piece of, the financial business, anything that's heavily regulated will give you a good crossover. But if you're an engineer or if you're in tech, we need all of that. We need all of it, right? You need the Internet of Things. We need to figure out how we're going to pull all this data together so that we can predict better, that we can predict better outcomes, and let the member, the patient, the provider control everything through these devices in a way that's, safe, secure, and has positive outcomes. So I think that there's a role in healthcare for everyone. I think it's the next, big industrial revolution. I feel like that piece is coming. Like it's just a matter of time before you got big tech and payer and provider and all of them trying to really figure it out. It's only a matter of time. So if you're passionate about healthcare, don't hesitate. Figure out a way in, find a mentor, find a company. I went with a company that, aligned with my own personal values, their mission did. That's how I connected. But, maybe it's a STRAVA, maybe it's where Veronica's at. So you can find, I think there's opportunity for everyone.
Yeah, I totally agree with Veronica, you as well as Alicia. I think there's so much opportunity coming into this space as a product manager. I think if you look in your toolbox and if you're a great negotiator, you could definitely do this. As Veronica mentioned, if you're a strong problem solver, you will have much success in this space. You can come from, I agree with you, Veronica, as it relates to finance, because there's a way of organizing data that will definitely help when you're building out capabilities. When you're coming from, like myself, from the media space, one thing that I know was valued is being able to curate content and build personalized experiences so it can help motivate and drive athletes. And even from manufacturing, being able to put pieces together, you can bring a unique point of view. So the door is completely open. I totally agree with Alicia that, that this field is going to be the next field that is going to have this huge disruption and a lot of opportunity for innovation and new thinking. That means that if you're not in this field, you will definitely have the opportunity to do. And also find, as you mentioned, find a mentor, find someone who's recently connected, and find someone who's a seasoned veteran in the space.
And you could definitely find those people here. I think that's one reason why we started this product and health tech community. So I would encourage everybody to join our Slack community, reach out to folks on LinkedIn who you see who are inspiring to you. I wanted to give a big thank you to Alicia Pina, to Veronica Seo, and to Tara King-Hughes for joining us today. Thank you so much for your insights and your expertise. We really appreciate you being here.
Thank you for having me.
Thank you.
Yeah,
it was a pleasure.